Welcome to my YouTube channel. Thanks very much for the subscriptions. For those ones who subscribe, those ones who have not yet subscribed, please do one thing: subscribe, put on a notification, and we continue to learn. Earlier on we saw the pharmacology of penicillins. Today we are going to look at the second class of drugs, and those are the cephalosporins, which are closely related to penicillins in their structure. Referring the difference only comes in their structure. The difference comes from the ring that attaches on the beta-lactam ring. These two drugs have a common factor, that is the beta-lactam ring. And when we look at the penicillins, they have a nucleus which is composed of 6-amino penicillinic acid and a thiazolidine ring attached on a beta-lactam. Then the cephalosporins, they have a nucleus which comprises of 7-amino cephalosporanic acid and a dihydrothiazine ring attached on a beta-lactam ring. So that's where the difference comes from. So looking at classification of cephalosporins according to generations and their routes of administration. So we have those ones which are given parenterally via intramuscular route or intravenous route, and those ones which are taken orally. So first generation drugs, we have cefazolin being taken parenterally, that is IM or IV, and those ones which are taken orally, we have cefadroxil and cefalexin. Then among second generation drugs that are taken parenterally, we have cefotetan, cefoxitin, and cefaloxime. And those ones which are taken orally, we have cefacla, cefoprozil, cefaloxime axetil, and lorcaprofil. Then among third generation drugs, those ones which are taken parenterally, that's IM or IV, we have cefotaxime, ceftazidime, ceftizoxime, and ceftriaxone. Then those ones which are taken orally, we have cefdinil, cefditoren, we have drugs like cefixime, prozectil, and others. Then among the fourth generation drugs, we have only one drug, that is cefepime, and it is taken parenterally. So we say the nucleus of cephalosporins contains 7-amino cephalosporanic acid, and here we're going to look at classification of cephalosporins according to their spectrum of activity. So we have the basic cephalosporins, that is cefazolin and the cefazidone. Then intermediate cephalosporins, they are partially stable against the beta-lactamase enzymes. The beta-lactamases, these are bacterial beta-lactamase enzymes. We have cefaloxime, cefamandor, cefotiam, and cefonicid. Then you have those ones which extended spectrum. So these ones, they can work on both gram-positive and gram-negative bacteria. We have cefotaxime, ceftriaxone, ceftizoxime, and cefmenoxime, and cefodizime. Then we have those ones which are active against Pseudomonas aeruginosa bacteria. We have ceftazidime, cefpirom, and cefpim. Then other cephalosporins we have cefalodin, cefoprezone, and the cefoxitin and cefotetan. So the first generation cephalosporins, they are very active against gram-positive cocci such as pneumococci, streptococci, and staphylococci. And they are not active against multi-drug resistant Streptococcus aureus, Escherichia coli, na Klebsiella pneumoniae, Pseudomonas aeruginosa, and Proteus, Enterobacter, Serratia, Marcescens, Citrobacter, and Acinetobacter. And note, cefazolin is the only first generation parenteral cephalosporin still in general use. So second generation cephalosporins in general, they are active against organisms inhibited by the first generation drugs. But in addition, they have an extended gram-negative coverage. So that is the difference they have with the first generation. The other ones concentrate on gram-negative, or rather on gram-positive, but these ones have an extended activity against gram-negative bacteria. So cefamandone, cephaloxime, cephonicid, and cephalanet, the cephacla are active against Haemophilus influenza, but not against Serratia or Bacillus fragilis. Cefamandone and cephaloxime are more resistant to beta-lactamase enzymes. These enzymes are produced by the bacteria. As with first generation agents, none is active against Enterococci or Pseudomonas aeruginosa bacteria. So the third generation cephalosporins, they have an expanded gram-negative coverage. Some are able to cross the blood-brain barrier, and they are active against Citrobacter, Marcenis, Providentia, and also effective against beta-lactamase producing strains of Haemophilus and Neisseria. Cefotaxime and cefoperazone are the only two drugs with useful activity against Pseudomonas aeruginosa, but reliably active against Enterobacter species, Serratia, Providentia, and Styrobacter. Cefotaxime is more effective on gram-negative than cephaloxime, and cefamandole but less effective on the gram-positive bacteria. So the fourth generation cephalosporins, we have a drug called cefpim. It is more resistant to hydrolysis by chromosomal beta-lactamase. It produced by Enterobacter. Has good activity against Pseudomonas aeruginosa, Enterobacteriaceae, Streptococcus aureus, Streptococcus pneumoniae, multi-drug resistant Streptococcus aureus, Haemophilus, and Neisseria. Useful in treatment of Enterobacter infections, and it penetrates well into cerebrospinal fluid. In the clinically important cephalosporins we have on market, among the first generation drugs, we have cefazolin. This one, it is the first generation parenteral cephalosporin. It has a longer duration of action, a smaller spectrum of action compared to the others. It penetrates well into the bone. Then we have cefadroxil and cefalexin. Cefalexin is a prototype, the first generation oral cephalosporins, oral administration twice daily, and is active against pharyngitis. Among the second generation, we have cephaloxime sodium and cephaloxime acetyl. Cephaloxime sodium is a prototype, second type generation, parenteral cephalosporin, longer half-life, crosses blood-brain barrier, can be used for treatment of community-acquired bronchitis or pneumonia in elderly and patients who are immunocompromised. Cephaloxime acetyl, administered twice daily, is well absorbed and is very active against beta-lactamase producing organisms. Among the third generations, we have these administered orally. We have cefdinil and cefixime. We have cefotaxime and penetrates well into cerebrospinal fluid. We have ceftazidime. This is active against Pseudomonas aeruginosa. We have ceftibutane and ceftriaxone. So ceftriaxone, longest half-life, higher doses can be achieved in blood and cerebrospinal fluid. It's effective against genital, anal, and pharyngeal penicillin-resistant Neisseria gonorrhea. The drug is excreted in urine and bile and may be used in patients with renal insufficiency. It has good penetration into bones. Fourth generation, you have cefpim. It is active against Pseudomonas aeruginosa.